Good morning, students. Today we have three topics to cover: leptospirosis, brucellosis, and salmonellosis. So I start first with leptospirosis, which is also known as Weil's disease. There are various names of this disease: field fever, Weil's disease, Japan 7-day fever. So it was first, please come in fast. जल्दी आ जाओ आप लोग. It was first described in the year 1886, and the case fatality, it may vary from 0.3 to 8%. So this disease is transmitted from humans to animal, and high prevalence in warm, humid, tropical countries. So warm, humid, tropical countries कौन सी होंगी? जहाँ पे रेनफॉल ज़्यादा है, ह्यूमिडिटी ज़्यादा है और समर सीजन भी प्रोलॉन्ग्ड होता है. Outbreaks occur as a result of heavy rainfalls and floodings. Now about the global burden of disease. More than 1 million cases are estimated worldwide per year, including 60,000 deaths. It is common in Gunaya, India, Philippines, and Thailand. Now about the epidemiology of this disease. It is caused by Leptospira. It is a bacteria. Source of infection is urine of infected animals, and especially wild and domestic animals like cattle, sheep, goat, buffalo, pigs, horses, and rodents. So children are more frequently affected than adults, and it is related to occupational workers like agricultural workers and those handling livestock. Certain environmental factors are associated with this disease, like poor housing, limited water supply, inadequate method of waste disposal. Now this disease can be transmitted directly as well as indirectly. Direct contact with urine or tissue of infected animals, through skin abrasions and intact mucous membrane. This bacteria can get into the human body. Indirect contact may be by ingestion of food or water contaminated with Leptospira, if it comes in contact with broken skin or with soil or through water, infected water. Last benches, please shift that side. Half of you shift that side. Just you 4 girls, shift that side. There may be droplet infection also through inhalation by breathing in air polluted with urine droplets of infected animals. So in 2018, WHO has given the statement that man-to-man transmission is rare. So whenever the disease is transmitted, it is from animals to humans through infected urine. Incubation period of this disease is 4 to 20 days. Now the clinical features of this disease, they may be divided into 2 types. They may be anicteric or icteric. Icteric word, it is used for jaundice. Jaundice, you all know jaundice, increase in the bilirubin content. So anicteric leptospirosis is milder form of disease, and the signs and symptoms seen are fever with chills, myalgia, conjunctival suffocation, headache. There may be renal involvement or involvement of lungs. In that case, there is cough, chest pain, hemoptysis. and these features disappear within 2 to 3 days. This disease, it may progress to severe disease and may even lead to death. Stop talking. Stop talking. Icteric is a severe form. The signs and symptoms here are jaundice, fever, myalgia, calf muscle tenderness especially seen, acute renal failure, nausea, vomiting, diarrhea, abdominal pain, circulatory collapse may be there, and certain signs and symptoms of lung involvement. Now, how this disease can be diagnosed? So, clinical features, they are not sufficient. So, certain tests have to be done, like CBC, complete blood count, blood urea estimation during the first week of illness. There is another test, agglutination test, which comes positive after 7 to 10 days of illness. Another test is indirect heme agglutination test, immunofluorescent antibody test. Even ELISA test can be done for immunoglobulin M antibody, and leptodipstick test is another test. So these are the various tests. If they come positive, then the diagnosis of leptospirosis can be made along with the clinical features. Now, how this disease can be prevented and controlled? Interrupt transmission route by wearing protective clothing, refrain contact with infected animals, swimming in contaminated water, and using clean drinking water. For humans, the source of prevention are vaccination, and prophylactically antibiotic can be taken. Control of infectious source. If rodents are there, they have to be controlled. Cattle, etc. are there, or those handling with livestock, they should give vaccine to the animals. Treatment is penicillin, which is a drug of choice. Another antibiotic is tetracycline and doxycycline. And if the disease progresses to complicated case, then there may be a need of treatment in ICU. That was about the disease leptospirosis. Now, I would like to ask some questions. Yes, आप बताइए. नहीं, third row. Yes. What are the signs and symptoms? Anything you know about leptospirosis? इतनी सारी स्लाइड्स मैंने आपको पढ़ के बताई. You know anything? Can you tell me 1 or 2 points at least about leptospirosis? And why you were talking all the time? Sit down. Any questions? So next is brucellosis. It is a zoonotic infection. Zoonotic means transmitted from animals to humans, with fluids from infected animals like unpasteurized milk, cheese. They may transmit this disease. So this bacteria Brucella is a gram-negative aerobic cocobacilli, and the tests to identify this bacteria are oxidase and catalase. Now about the epidemiology of this disease. It occurs worldwide. Endemic areas of this disease are in Mediterranean region, Arabian Gulf, Indian subcontinent, and some parts of America. Human infection, melitensis, is a species that infect humans most frequently, and the incubation period, it ranges from few days to few months. So mainly it is transmitted to humans from infected farm animals. So those who are handling livestock or farm animals, they are more prone to get this disease. It may be transmitted by direct inoculation through cuts and skin abrasions from handling animal carcasses, placentas, or contact with animal vaginal secretions. There may be direct transmission through contact with conjunctiva or inhalation by infected aerosols, by contaminated foods such as raw milk, cheese, unpasteurized milk, raw meat, and venereal transmission has been suggested. So for this disease, incubation period is about 1 week to 6 weeks or even months. The length of incubation period is influenced by many factors. So there are various strains of brucellosis. Virulence of infecting strain, it gives how much is the incubation period depends on the virulence. Size of inoculum, what is the route of infection, and also depends on the resistance or the immunity of host. Now about the signs and symptoms of this disease. Influenza like fever which reaches 38 to 40 degrees centigrade. Limb and back pains are the pain is severe, night sweating and fatigue is there. Anorexia, that is loss of appetite, weakness, severe fatigue, loss of weight, depression, headache, these are the various signs and symptoms of the disease. Now about the blood picture, there is relative lymphocytosis, that is lymphocytes will be increased, and relative leukopenia. Leukopenia is leukocytes, they are decreased. On physical examination, there is enlargement of spleen. In certain complicated cases, there may be endocarditis or even hepatic abscess, that is abscess in liver may be seen. A few cases of brucella infection may involve prosthetic devices like pacemaker wires and prosthetic joints. It may even involve the artificial devices. Now about the treatment. Tetracycline, aminoglycoside, rifampicin, quinolones, and third generation cephalosporins may be given for treatment. For the prevention of this disease, immunization using the strain B abortus strain or B that is Brucella melitensis strain. Routine pasteurization of milk or consumption of raw milk should be avoided, and in lab strict biosafety precautions should be practiced. Stop talking, last benchers. What is brucellosis? Yes, आप बताइए. How it is transmitted to humans? Which animals? Farm animals. So what are the clinical features? Next student. How will you identify brucellosis? What are the various signs and symptoms? How will you diagnose? कोई टेस्ट है डायग्नोसिस के लिए? कैसे डायग्नोस करोगे, कैसे पता करोगे? यस, आप नेक्स्ट बताओ. देयर आर सो मेनी टेस्ट, एक टेस्ट तो बताओ कौन सा टेस्ट होगा? यस, नेक्स्ट। ये था क्या, मैंने पढ़ाया अभी ये वाला टेस्ट? पढ़ाया ही मैंने ब्रुसेला के लिए। किसको पता है हाउ इट इज डायग्नोस्ड ब्रुसेलोसिस? सिट डाउन। पढ़ भी रहे हो आप लोग? कोई क्वेश्चंस का आंसर तो मिल नहीं रहा मुझे। यस, आप बताओ पीछे। Yes. So ELISA, serum agglutination test. These are the tests to diagnose brucellosis. Very good. Sit down. So next is salmonellosis. So salmonella infection, basically it is a type of food poisoning. It is acute gastroenteritis caused by ingestion of food or drink contaminated with either living bacteria or other toxins or inorganic chemical substances, poisons derived from plants and animals. So this is in general how food poisoning can be caused. So if anyone is infected with food poisoning, there is history of ingestion of some common food, attack of many persons at the same time, and similarity of signs and symptoms in majority of cases. So there may be two types of food poisonings, bacterial or non-bacterial. So today we are dealing with the bacterial, that is food poisoning caused by salmonella. So bacterial food poisoning, it may be caused either by food infection or food intoxication. So food infection, it refers to presence of bacteria or other microbes which infect the body after consumption of that contaminated food. And food intoxication means ingestion of toxins contained within the food, including bacterially produced exotoxins. Now, salmonella food poisoning is an extremely common form of food poisoning. 5 reasons have been given for its increase. Communal feeding, जब ग्रुप्स में कोई फूड इनटेक होता है. Increase in trade of human food, especially the cooked food. Higher incidence of salmonellosis in farm animals. So they will be, if farm animals are infected, the disease will be transmitted to humans. Widespread use of household detergents interfering with sewage treatment. So this, if sewage is improperly treated, it will infect. Wide distribution of prepared food. So if the food is already cooked, there are chances of infection. So the agent is Salmonella typhimurium, Salmonella cholerae, and enteritis. Source: man gets the infection from animal and poultry through contaminated meat, milk, milk products, sausages, custards, egg and egg products. Another source is rats and mice. They often heavily infect and contaminate foodstuffs by their urine and feces, and the disease can also be transmitted through the carriers, which are humans. So within 12 to 24 hours the symptoms they appear. The causative organism on ingestion multiply in intestine and give rise to acute enteritis and colitis. So the signs and symptoms will be mainly gastrointestinal. There is also fever, there are chills, nausea, vomiting, profuse watery diarrhea which last about 2 to 3 days, and mortality is about 1%. Convalescent carrier state, it lasts for several weeks. Convalescent carrier state means treatment हो गया patient का, but the patient is not adequately treated, so the patient will act as a carrier, and even after recovering from signs and symptoms, he or she will continue to transmit the disease or spread the disease. So the clinical features are sudden onset of vomiting, abdominal cramps and diarrhea. In some severe cases, blood and mucus may appear in vomiting or in diarrhea. Fever is rare and death is uncommon. Now, how the disease can be diagnosed? So it is important to take proper detailed history of the case, including time of onset, duration of illness, symptoms. There may be history of travel, recent meals, what foods has the patient taken, cooking and refrigeration, details of others with similar complaints. In clinical examination, vitals are taken and degree of dehydration is assessed. Systemic signs, they are looked for. In lab, the diagnosis is confirmed by taking samples like stool sample, sample of vomitus or gastric aspirate can be taken, and the food specimens, जो भी food patient ने consume किया है, the suspected food, that sample is also taken. Ensure proper identification of disease, determine causative agent if present in food sources with epidemiological markers. So biotyping, serotyping, PCR, phage typing, these are done to identify the causative agent. Now, how the food samples they can be collected? By using aseptic technique and appropriate containers, samples are to be refrigerated during storage and transport, and that food which is collected as a sample, it should arrive the lab within 3 days of collection, and during transport it is refrigerated. Minimum 100 gram sample is taken, and the container that is filled with the sample, it should not be more than 75% of the capacity, or not more than 3/4 of the size of container. Proper labeling is important, and after labeling that container, it is kept in a Ziploc bag and sealed. So for transportation, vaccine carriers they are used. Vaccine carriers, they are containers which are lined by ice packs. So the sample it is kept at a lower temperature at 2 to 8 degrees centigrade during transportation. That is, cold chain is maintained. So once the diagnosis is confirmed, the treatment is started. Use of antibiotic is considered, but it is also important to treat dehydration which is caused due to vomiting and diarrhea by giving oral rehydration therapy if dehydration is of mild or moderate, and if it is dehydration is of severe grade, then intravenous fluids they are also started. How the disease can be prevented? By maintaining personal hygiene, by proper hand washing before consumption of food. Proper storage of food, that is refrigeration, is important. Food safety education should be given to community and to the various food handlers or cooks. Environmental measures taken are discourage sewage farming, that is जो sewage treatment plant से treatment के बाद जो water आता है उसको use करने के लिए farms में उसको कई बार use कर लेते हैं, but that water if it is not treated properly, then it may lead to a source of infection. So that is known as sewage farming. It should be discouraged for growing fruits and vegetables. Sewage farming is only used for certain crops like fodder for animals or grass. So for food safety, there are 5 keys. First is keep clean, that is wash hands before handling of food, and during preparation. Wash hands after going to toilet. Wash and sanitize all the surfaces and equipments for food preparation, and protect kitchen from insects and pets. If the food preparation area will be cleaned properly, then the insects and pets will not be there. Second is separate raw and cooked food, because raw food, it can be a source of infection to the cooked food. So separate raw meat, poultry and seafood from other foods. Use separate utensils for handling raw food, and store food in containers to avoid contact between raw and cooked food. Then cooking, it should be done thoroughly. Meat, poultry, eggs and seafoods, they should be cooked thoroughly. Bring soups and stews to boiling. Reheat cooked food thoroughly, and consumption of half cooked food, especially the seafood, it should be avoided. Keep food at safe temperature. Don't leave cooked food at room temperature for more than 2 hours. Prompt refrigeration of cooked and perishable food is advised. Keep cooked food piping hot prior to serving. Don't store food too long, even in refrigerator. Don't thaw frozen food at room temperature. And the fifth one is use safe water and raw materials. Safe water, that is for drinking purpose and cooking purpose. The water used should be clean and hygienic. Select fresh and wholesome foods. Choose foods processed for safety, especially milk, it should be pasteurized. Wash fruits and vegetables if they are eaten raw, and look for the expiry date for the food. Expired food, they should not be used. So these are the 5 keys to safer food.